Assalamu alaikum and good evening, everyone. And a very warm welcome to today's highly anticipated webinar, 365 Days to Match, organized by Nibras Research Academy under the visionary leadership of its founder and CEO, Dr. Mohammed Siddiqui. It's an honor to stand before such a driven, ambitious audience, future researchers, and change makers who are tirelessly working toward the dreams of matching into US residency programs. Today, we are here to unravel the secrets of achieving this milestone in just 1 year, a feat that demands strategy, resilience, and unwavering dedication. We are privileged to have with us an extraordinary guest speaker, Dr. Sheena Shamoon, a name with excellence in the IMG community. Dr. Shamoon's journey is nothing short of inspiration. An alumna of Rawalpindi Medical University who matched into internal medicine at the university at the Fellows Jacob School of Medicine. After completing all USMLE steps and OET within just 365 days post house job, her relentless pursuit of excellence didn't stop there. She has an impressive portfolio of 30 plus research publication and presentation at elite conferences like AHA, ASCO, CHEST, and ASH, alongside clinical observership at Johns Hopkins, Mayo Clinics, and University of Texas, Houston. Her story has even been featured in the News International, cementing her as a role model for IMGs worldwide. Today, Dr. Shamoon will share her actionable insight, time management strategies, and the mindset that propelled her success. So you too can turn the seemingly impossible into reality. Without further delay, please join me in giving a virtual round of applause to welcome Dr. Sheena Shamoon. Dr. Shamoon, the floor is yours. Thank you for joining us today. Let's start.
Assalamu alaikum, everyone, and good evening. This is Sheena Shamoon, and thank you very much, all of you, for being here today. And I'm really honored to do this for you, and I really look forward to sharing my 2 cents about the match and the USMLE journey. And I hope to answer all of your questions. So I think let's just, yes, I just saw a question already. So yes, so the way this is going to go is that we have the time of about 1.5 hours. So we'll be spending about 1 hour where I'll tell whatever everything that I want to share with you guys. And we'll leave about 30 minutes for all of your questions. And as you must know that our session is divided into 2 days. Today's the day 1 and tomorrow will be the day 2. So we'll be discussing half of our things or half of our topics today, and the rest of the topics will be tomorrow. And you shouldn't worry about the fact that there's only the capacity of 100. So if you're able to join today, you might not be able to join it tomorrow. That's not the case because tomorrow we'll also be going live on YouTube. So you can, if you're not able to join us here on Zoom, you can always join us on YouTube. So let's just begin with this and let's do this. So before we begin, I just want to take a moment and say that this is my personal USMLE journey. I'm going to be sharing how I did everything that I did in the, in 1 year. But this is not at all meant to pressurize or rush anyone into thinking that this is how they're supposed to do it, or this is the only way that it can be done. So, I mean, it's a very taxing journey. It can get very stressful and very lonely at times. So you do what works for you. I'm here to share my 2 cents about this journey, and the rest of it is, whatever works best for you. So I graduated from Rawalpindi Medical University in 2022. And after which I started my house job and completed my house job in September of 2023. After which I took 1 month break, because you need break after house job. And then I started preparing for my USMLE step 1 in November. And I spent about 3 months preparing for step 1, and then took my step 1 and OET, both of them in January of 2024, last year. So after that, I went to US. I actually got done with my step 1 and OET on 27th January, and I flew to US on 30th January, like 2 days after. And then I did 4 months of US clinical experience from February to May in University of Texas, Houston Methodist Hospital, University of Kentucky, and then Johns Hopkins. That's when I came back. So simultaneously, I started studying for step 2 while I was still there. So I would say that my step 2 preparation had a total time of 6 months, which was from March to August. And I would say that the 3 months with the US clinical experience was the undedicated period of time. And the rest 3 months, when I came back in June, that was the dedicated period for me. So I took my step 2 on 29th August, and then I flew back to US on 30th August. And I got ECFMG certified on 17th September, and the deadline for ERAS was 25th September. So I got lucky, and I just got certified just in time. So in my second trip to the US, I did 2 months of US clinical experience at Mayo Clinic, and then in September and October. And then in November, in November, I started preparing for my step 3. And in December, I took my step 3. And then I just gave my interviews, up until February. And last month, just 1 month ago, I mastered into University at Buffalo in categorical internal medicine. So just give me 1 second so I can allow everybody who's in here. So, right. Okay. Okay. So this is one of my favorite pictures. It shows that, I just made a guy. Actually, I was supposed to make a girl, but we just made a guy, but never mind. So this is, if I can actually see this to be myself, that I have this first aid of step 1 with me wherever I go. The reason is, I'll also share when I share my strategies for the preparation of STEPS exam, that I would say that the first aid for step 1 was the one book that I found out to be the most helpful resource, not just in step 1, but in step 2 and step 3 as well. So, honestly, if I had to choose one book out of all the books in the world for my career aspect, that would be the first aid for step 1. So, that is what I was saying. So now I'll be sharing just a little bit about my preparing strategy for step 1, step 2, step 3, and OET. But before I do that, I just want to make sure that you know that this is just one of the ways to prepare for your STEPS exam. There are a million ways you can prepare for your STEPS exam, but the most important thing to remember is that always prepare for an exam the way it works for you. Whatever works for me might not work for the next person, and whatever works for you might not work for me. So the very important thing is that do what you feel is working for you. You have your own timeline, you have your own studying strategy, you have your own resources. The end goal is the same for everyone. So, you'll hear millions of people telling you different ways to prepare for your STEPS exam, and none of them are wrong. The only thing is you have to find out which one is resonating with you. So for my step 1, as I told you that my preparation time was about 3 months. So I'll tell you how I would prepare for step one in 3 months. But before we go ahead, I would like to share that if you're somebody who is preparing for step one, or who has prepared for step one, you might have come across a number of resources, the most common being the first aid, the pathoma, UWorld, Boards and Beyonds videos, sketchy videos, and the dirty medicine. So all of these resources are out there and they're amazing resources, but it doesn't mean that you have to do all of them. So whatever works for you is the right thing to do. So the way I would strategize and I would advise for preparing for step one is that I see a lot of people studying for step one in a way that they start with sketchy videos, or they start with Boards and Beyonds video. They watch all of the videos and then they go ahead and start studying. While that is the right way, if that is what works for you, but in my opinion, you do not need to watch all of sketchy. You do not need to watch all of the Boards and Beyonds. The reason being that there are so many videos of Boards and Beyonds and so many videos of sketchy that you cannot possibly remember everything. So but what it does is that it does take up a lot of your time as well, and your brain gets over flooded with information. I mean, there is only so much that you can retain in your brain. So uh, what you have to do is that what I would do is that I would read a particular topic from first aid, first of all. And if I understand everything that's written over there, I would go ahead and do my UWorld questions. But if I read something in the first aid and it's something which I realize that I cannot understand, or there's something which I'm forgetting about it, then definitely I would go and watch the Boards and Beyonds videos for that. And once I've watched the Boards and Beyonds videos, I would just go ahead and do the UWorld questions for that. So what it helps is that in this way, you do not waste way too much time watching the videos of Boards and Beyonds, but at the same time, you do watch the videos of the concepts that you are weak in. So, I mean, the end goal is to make solid concepts and reproduce them in your exam, not just covering tons of resources or doing tons of questions. So first aid, if you don't understand, go to Boards and Beyonds, you do UWorld, and that's how you do it. So once you're done with your first aid, UWorld, and Boards and Beyonds, what you want to do is that you want to start taking your assessments. And once you start taking your assessments, the important thing to remember is that you have to get a consistent score. So you have to get a very consistent score for it in order to be able to sit in the exam. The other thing I would suggest is that spaced repetition and Anki Dex, those are the two things that would really help you out a lot. The reason being spaced repetition is that since you do so much work that you've studied so many things all together that it's very easy to forget them. So very good to do is that you make your own Anki Dex, or you do spaced repetition of the topics that you've been studying. However, if you're somebody like me who's just preparing in 3 or 4 months, you might not even need that spaced repetition because you don't forget things in 3 months. But if you're somebody who's preparing for more than 6 months or a year, then definitely spaced repetition is your way to go, because you don't want to continue going forward and then keep forgetting the things that you can, that you studied in the start. The assessments, of course, I'm sure as most of you must know that there are the NBMEs, the UL self-assessments, and your free 120. So, but one very important thing to remember is that when you take an assessment, make sure that you review your assessment as well. Very important question about step one. Is it enough to just pass? So as you must know that there are, since 2021, the step one is now pass fail instead of a 3-digit score. So while it's easier to pass an exam because your passing score is, I guess it's 196 now. So it's definitely easier to get a 196 than to get a 256, which was, the standard when it used to be a 3-digit score. So the question arises that, is it enough to just pass your step one? While it may serve the purpose that you're passing an exam, the problem with it is that your step 1 is your basics, which are going to follow you in your step 2 and in your step 3 as well. So if you haven't made a very strong foundation in your step 1, you're going to be struggling a lot in your step 2 and step 3. So no, it's not enough to just pass. It can serve the purpose of doing the USMLE step 1, that you're passing your exam, but this is going to cost you a lot in your step 2 when you want to aim for a very high score and you're not getting there. You're eventually going to have to come back to your step 1 preparation to boost that score. So what I suggest is that even though it's pass fail, you should always, always, always try to make very strong foundations. And that's what I said, that you should have a consistent above 70% score in your NBMEs for you to be able to sit in the exam. Now coming down to the USMLE step 2, which is the monster of the exams and a very, very important component in your, USMLE journey. So study duration, well, for me, it was about 6 months, but I would not say that it's very less or too much. I mean, again, you do what works for you. You can even take 8 months or even a year for preparation of step 2 because it's a very high stake exam. So you want to get the score that you want to get. So, your time limit can vary, your preparation time can vary. For me, it was 6 months. And I would say that the first 3 months, which were the March, April, May, were the undedicated time for me, which means that I was doing US clinical experience at that time. I was doing my observerships and I was preparing for step 2 as well. But in the dedicated period, that is a period that you only eat, sleep, and study. That is your dedicated period. And for me, that was the 3 months, which was June, July, and August. So, I mean, in your dedicated and undedicated time, so that is how it is. So for step 2, you will come up with a lot of resources. And this is where I would suggest that, I would suggest that, I'm sorry. Okay. So this is where I would suggest that you want to get your target score. And for that, you can do as many resources as you'd want. So the resources most commonly people do in step 2, which even help the most, are the UWorld, of course, the AMBOSS question bank, Divine Intervention podcast or notes, the CMS forms, and again the Anki decks. So the AMBOSS question bank and the UWorld question banks, they are equally good in my opinion. I prepared with UWorld, but I do have a lot of friends in 260s who prepared with the AMBOSS question bank. So whatever you want to choose, that's your choice. I mean, you can try both of them and see which question bank works the best for you. And you can use that as your main question bank and then, go ahead with it. So my strategy for preparation of step 2 would be, again, you'll come up with a lot of people telling you different ways how to do step 2, how to prepare for step 2. So your strategy that I adapted while I was preparing for my step 2 was that I divided my UWorld into 50-50. I did 50% of my UWorld in tutor mode with specified systems. What I used to do was that I would choose medicine, then I would choose cardiology, and I would do 50% of medicine of cardiology in the tutor mode. And similarly, then I'd move on to the next unit. I'll move on to nephrology, I'll move on to gastroenterology, and do the same, that I would do the 50% medicine of gastroenterology, 50% medicine of nephrology. And once I was done with 50% of medicine of everything, I would move on to surgery. And I would do 50% surgery of everything. Then I would move on to peds, and I would do 50% peds of everything. So once I'm done with total 50% of my UWorld, I would switch to the timed and random mode. And in that case, I would just choose medicine, surgery, peds, and gynae, everything all together. I would choose all the organ systems all together, and then I would do them in timed mode. The reason for doing this is that once you do things in your tutor mode, you just want to focus on building your concepts. You know, uh, you just want to make your concepts as solid as you possibly can. And with 50% of UWorld, you make more than 50% of your concepts. So in the next 50%, when you're doing questions in random and timed mode, what you're actually doing is you're actually preparing for your actual exam day. So this is what I would suggest, that this is how I did it, and it worked very well for me. So if this is something that you want to try, you definitely should, and then you can see that if this is something that works for you. Then assessments. So compared to step one, I would say that the assessments of step two are very, very important, because you'll get to see how much you're scoring and if you're going in the right direction. Like if your scores are consistently improving, even by a little margin, like 5 or 10 or even 2 or 5, I would say that you're going in the right direction. But if you're taking NBMEs or assessments and your scores are decreasing, there's something wrong with your preparation. It could be that you're burned out, or it could be that you've changed some strategy and that strategy might not be working for you. So it's very important to take assessments in step two. And the sooner you start taking those assessments, the better it is. And once you're done with all of your UWorld and you've taken your baseline assessments and you're getting a score, that's when you move on to the next resources. That's when you start doing the MBOS. You don't have to do everything from MBOS. There are certain things that you want to do from MBOS, which is, um, some 200 high yield concepts. Then there are some ethics questions, some quality improvement questions, some safety improvement questions. So those are the questions that you want to do from MBOS. And I know I'm saying a lot of things that are hard to digest right now, but don't worry about that, because very soon we'll be making the PDFs for the preparation of those things. And I'll share with all of you about the things that you need to prepare from MBOS, the things that you need to prepare from divine intervention, just so that you have everything in the written. So I'm hoping that we can do it by next weekend, hopefully. Um, then from MBOS, you'll move on to your divine intervention podcast that are very high yield. There are about, I would say, 20 to 30 podcasts or 20 to 30 notes that would give you a lot of information, and that actually boost your score a lot. So after doing MBOS, you will end Divine Intervention podcast. If you're still scoring in 230s or even 240s, if you're somebody who's targeting for a 260, so I would suggest that you do CMS forms. If you're already scoring, 250s with MBOS and Divine Intervention podcast, you can even skip CMS forms if you want. But if you want to boost your score to a 260 or a 270, I mean, I'm not saying get a 270, but if you want to get a 270, so you can always do the CMS forms. So that is how I would prepare for step two. One very important thing in the preparation of step two is that your feedback cycle. What I mean by that is it's very important to know your weak areas. So once you know what your weak areas are, you work on those. Instead of doing and repeating everything again and again and again, it's not going to boost your score. What boosts your score is that you realize what your weak areas are and you work on those areas, and that's how you boost your score. So a very frequent question that I get asked about taking notes for step two is that how should we take notes? And if we're taking notes on the UWorld notebook, we're just adding too many things on it, and then we start getting stingy about it, that we have too many detailed notes, so we want to make it a little less detailed, so we remove things from there. So we're actually very confused about what we should do. So I would say what I would suggest is that you should make your notes on your UWorld notebook, and I would say that make very detailed notes. You're doing your questions, you come across a table or a flowchart or something even in the description of your answer that you cannot remember or that is new to you, I would say just add it in your notes. You will feel at times that your notes are too detailed, like you've added everything in your notes, but let me tell you one thing, that once you're done with your UWorld and you have made a notebook which consists of like 200 pages, it's still better than making a notebook of 50 pages. The reason being that once you're done with your step two, you would randomly remember that, oh, I studied this particular thing in UWorld. but you cannot remember where. And there's no way of finding it out because there are about 4,000 questions in your step 2 U world. And you just randomly remember one topic and you realize that, oh, there was a table I studied in my U world and it was very well written and there were so many good things, but oh, I didn't add that in my notes. So that is a moment which is quite stressful and you don't want to do that. So the good thing to do is that just add it in your notes. Just add everything in your notes because at the end of the day, even if you make a 200 pages notebook, it's going to take you less than a week to go through that notebook compared to if you just remember that, oh, I need this table, but I can't remember. That's going to cost you a lot when you're searching for it in those 4,000 questions. So my advice would be that make detailed notes if you have to. So biggest step 2 mistake that even I made in my time, and I realized that my scores were stagnant after that. But when I improved this mistake, I rectified this mistake, my scores were boosted. That is not reviewing your assessments. So when you take an NBME or you will self-assessment, you have to review your, your assessment just like you would do the UWorld. The reason is that when you review your assessment and particularly your wrong questions, that is when you learn what you're lacking at, what you're not good at. That is the area that you want to work on, because what happens is that when you take an assessment and you're weak in one particular area, but you do not review your assessment religiously, so when you take the next assessment, you're still lacking in the same area. The reason being, even though you've divided all of your notes and all of your notebooks and everything, you're still making the same mistakes in the next assessment. The reason is that you're not reviewing your assessments very well. So that is something that you really, really want to do, that review your assessments religiously. And trust me, that is something which is going to boost your scores like really, really well. So this is a very good picture. And your step 2 CK used to be a very innocent exam when step 1 was in pass fail. The reason was that you were aiming for a 250 in your step 1, so you would do a lot of things better before than you do now. But now that step 1 is pass fail, what the students do is that you just study for step 1 for it to pass. And as I said before, that if you just study for it to pass, you're going to struggle with your step 2. So with step 1 being pass and fail, your step 2 is actually become more of a monster, and it gets very bad if you haven't prepared for your step 1 very well. Now, USMLE step 3. So I prepared for my USMLE step 3 in 1 month. The exam structure, as you must know, that it's taken in the US and it consists of 2 days. So you can schedule your day 1 and day 2 with a break of 14 days. 2 weeks is the maximum time that you have between your day 1 and your day 2. But I would suggest that you split it across 1 week for better preparation. The reason being, your day 1 is your multiple choice questions of, the components from your step 1 and step 2. But on the day 2, you have your multiple choice questions, but at the same time, you do have the clinical cases, the CCS cases. So since you do have MCQs on the second day as well, it means that you still need to remember things from your day 1 and step 2. So, finding a perfect balance between getting a good break between day 1 and day 2, at the same time, doing, not forgetting the information from day 1. I think that it's a very sane choice to take a break of 1 week between the day 1 and day 2. So for the study preparation of step 3, I would say that there is, of course, the UL for step 3. There are CCS cases, there's a biostat review, and there are divine intervention podcasts. I was somebody who didn't do 100% of UL for step 3. But that worked out well for me. But I mean, if you can do step 3, you will complete, that is great. So you would do the UL step 3 first of all, and then you would, move on to your biostats review, because that is on your day one. And for your day one, biostats is something that you want to do really, really well. And UWorld has a separate part for it, but other than that, you can always watch the Randy New videos. And for your day two, which, you have a 1 week prep time for day one and between day one and day two. So what you can do is that for your day two, you do the Divine Intervention podcast, and then you would do the CCS cases as well. Um, I do understand that since it's a very taxing, very tiring journey, and when you're preparing for your last exam, it gets really exhausting, and you just don't have the motivation to do it. Even though it's your last exam, you don't feel the momentum building, you know. So what I would suggest you do is that since you're already in the US and you already have a break of 1 week between your day one and day two, I would say just go out, chill with your friends, see some, wherever cities you're in. I'm sure there are a lot of places to see. So just take a break, don't study all day for step three, day two. And, that is something relaxing would be something that would help you with your, the burnout and the exhaustion and, all of that. But the good news is that once you're done with your step three, you're actually done with whole of USMLE for the rest of your life. So that is one way to motivate yourself for preparing for step three. So the important question here is that does your step three score matter? The answer to this question would be yes and no. Um, no being that for residency, it doesn't matter too much as the score of step two does. The reason being, that most of the American graduates, I would say, if not all, they do not take their step three before starting their residency, because you can take your step three within first year of your residency. So most of the American graduates, they would take their step three in the first year of residency. So there's not that is one of the reasons that for residency your step three score doesn't matter. However, there are two perspectives in which I would say that your step three score matters. The first one being that if you have a misstep in your step two score, like if you haven't gotten a very good step two score, then step three can be something as a compensatory mechanism for that. Um, you can always get a better score in your next exam if you haven't scored better in your previous exam. That is a way of showing that you're not lacking knowledge, you're not lacking the capacity. It was just a mishap. So that is one way where your step three score matters. And the other way is that if you're somebody who wants to go into very competitive fellowships like cardiology or gastroenterology or hematology, oncology, so that is where your step three score would matter. So yes and no. So that is how I would prepare for my step three exam. So that is, that is the motivation I would say you can keep with yourself, because once you're done with your step three, you're actually done with the USMLEs for life. So that's how it is. So general tips for medical students. Just give me 1 second. Let me. Okay. Okay. Can you guys see my screen sharing? Okay. I'm not sure if you guys can see my screen. Can you guys see my screen? Okay. So, my tips for medical students here. I would say that you're not gonna get this time in your life back, you know. The other thing to consider is that I do understand that it feels like everybody is doing something, you know. I'm sorry, somebody said they can't see my screen, so. Okay, great. Um, Sorry, I just thought that I lost my screen. So yeah. Okay. So I would say that first of all, you're a medical student. You're never gonna get this time in your life back. The other thing is that I do understand that a lot of the people around you are doing USMLEs or PLAB or different pathways, and everyone has their own their own journey, and everyone has their own aspirations. So it's not a rat race. Just because something is working for somebody doesn't mean it's going to work for you as well. So you have to figure out what you want to do. Find mentors early and peer accountability. So the next thing I would say is, so these are the things that I would advise you to do as a medical student. If you're a medical student who wants to do uh, USMLE or whatever you want to do, the most important thing is that you make timely decisions in your journey. The way it works is that, I don't know, I mean, most of the medical colleges, they don't have, they don't have the career counseling options. They don't have the aptitude testing. But since you're all, most of you are Gen Z or, all of those. So you can always, learn from Chat GPT. You can always learn from ChatGPT. So the other thing to consider here is that whatever you decide, you want to do USMLE, you want to do PLAB, you want to do whatever pathway you want to follow. The important thing is to stay sincere to your journey. Start preparing early. Start making timely decisions. And the most important thing here is that start finding the right mentorship. Because once the important thing about making connections and finding mentorship is that the longer you have a relationship with somebody, the more likely they are to help you. If you are somebody who's preparing for your steps or even taken your steps, and before applying for a match, 6 months before applying for your match, you reach out to somebody and you ask them, that you want their mentorship. They would tell you answers, they would advise you as well, but what happens is that they are very less likely to go out of their way to help you. So if you cannot even prepare for your USMLEs or your exams during your medical school, the other thing that you want to do is that you get your mentors and you start building a relationship and a connection with them. The other things that you might want to do here is that you might want to volunteer in your university's student societies. You want to build your leadership skills. If you're somebody who can afford to do electives, or your college is some college that participates in the elective exchange programs, you can always do those. The important thing to consider here, which I did in my time as well as a medical student, and I see most of the medical students doing, is that they attend every workshop there is, they attend every session there is, just for the sake of getting a certificate. And at the end of your medical school, you have a big bunch of certificates. But let me tell you that you do not get to use those certificates anywhere. The reason is that the application, the ERAS application for your match is, it just allows you to put 10 experiences. And in those 10 experiences, you will never put your certificates because you have way more important things to show for yourself in those. So instead of just attending a workshop or something for the sake of attending it, just attend it for the sake of getting knowledge, getting information. So that is one aspect of it. The other thing that I would suggest that you do as a medical student is that once you have clarity about what you want to do for the future, what you want to, pursue USMLE or whatever you want to pursue, get the right mentorship, start preparing for it early, start preparing for it right now as you're, like applying for a match in the next session. What I mean by that is leadership skills, volunteer work, good grades, and very important, your communication skills. So that is something that you want to do in your medical school. So now we're going to talk a little bit about the research for residency application. The question being that, is it required for residency? I would say definitely yes. The reason is that in the US, all of your, all the hospitals, all the institutions, whether they're a community program or a university program, they do have some research going on. Because unlike our country or our system, they pay too much attention to research. So yes, it is required. And the other aspect is that why research is important for match. The other thing is that they want to see that you're somebody who's not just good with studies, but is good with other things as well. And research is one of those other things. So yes, research is required. The other thing is how to start and what's the hierarchy for, doing research. What I would say is the way I started doing research is, as Dr. Maria shared earlier in my introduction, that I've done about 30 research projects in 1 year. Uh, it didn't start like that. It wasn't that one day I just woke up and I started doing research and I published 30 papers in 1 year. No, that's not how it is. I have been trying to learn research for the last 4 years. While I was in the third year of my medical school was the first time when I started learning research. However, I had my first publication when I was in the final year of my medical school. And that too was published in the journal of my medical college. That was not an international journal. That was not a PubMed index journal. That was the student journal for my university. So the hierarchy, how it starts is that the first important thing is that you learn research. You learn the basics of research. How do you learn that? If you have a very strong research society in your university, that is the best way to go because your seniors are like your friends. So an in-person mentorship that is going to teach you more things than anything else would. But if you do not have a strong university program, you can always go to YouTube and you can always learn how to do research. But the downside of doing that is that you will theoretically learn how to do research, but you will not be able to practically do it because you do not have any mentorship. That's when the research academies jump in. That is the kind of money that you want to spend. So if you do not have something in your university who can teach you research, or you're not able to learn from YouTube, you can always join a research academy. And once you join a research academy, the important thing, the good ones, are that they would teach you how to do research, like theoretical components of research, and they would provide you mentorship for doing the projects. So that is how you do your first project. And once you're done with your first project, how your hierarchy starts is that you start doing different projects with your friends, your classmates, and your seniors. And from there, you start working with, the residents and fellows and the faculty of your own university. And once you're done there, then you move on to the next phase, which is working with the residents and fellows in the US. How do you reach out to them? The most important thing is that when you go for your US clinical experience, that is a great opportunity for you to build connections and work in research with your residents and your fellows. But even if that's not happening, you can always reach out to people on LinkedIn, and you can always do research with them. The key point to notice here is that your residents and your fellows, they in the US, they require research for, and for their career, but they don't have the time for it. So you are the people who are providing them with the time that they don't have. So that's how you do. So basically, the residents and the fellows in the US, they have a requirement of you. They need you for their research projects. So they're not only doing you a favor, you're doing them a favor as well. So that's how it begins. And once you go for your US clinical experience, your observerships or electives, whatever that is, you can always start working on different research projects with your attending doctors. So that's how it's going to be. Then comes the funding and mentorship. Again, this is where your residents and your fellows jump in, because they have the money, but they don't have the time. So, they provide you with the overview, they provide you with a little bit of mentorship, they provide you with the funding to present your papers in, different conferences, because they have access to those conferences. At the same time, they have the money to pay for the publishing process as well. So your residents and your fellows are your ATM for research. Project types. There are multiple types of researches that you can do. The hierarchy from the best studies to the average studies is your meta-analysis or your, narrative reviews, and then, your original studies, and then, you can always do the CDC analysis and all of those. And the least, I would say, the lowest thing on the hierarchy is your case reports. The reason being that, especially in Pakistan, we do not have very good case reports. The reason is that we do not have a very good follow-up of patients. And even if you do get a patient who has, who has a very rare disease that you want to write a case report on, it's very likely that even if you identify that patients, your seniors, your residents, fellows, your faculty, they're going to take that case report from you. So the case reports are the things that I, do not like very much. So I'm a very big fan of doing meta-analysis. They're easier to do, they're very important, and especially very, very popular in the US. Red flags, ghostwriting and predatory journals. That is something that you don't want to do, because it's very important to maintain your ethics, whether you're doing research or whatever it is that you're doing. So working for somebody who's taking credit for your work, I mean, freelancing is a different thing, but working for somebody just for them to take that credit, that is not the right thing to do. At the same time, you want to stay away from the predatory journals, which are, they're going to charge you a lot of money to publish your papers. They're going to have a lot of, fake impact factors and a lot of other things, but they're actually not good journals. So that's very important to stay away from. What to let go in research and what not to tolerate. So for me, I would say that it's very important to understand that when you're learning research, you will come across a lot of people who would be very, very harsh to you. But it is okay to let that go if they are the kind of people who are teaching you research. If you find somebody who is genuinely a good teacher, who's actually teaching you how to do research, and they're being harsh with you, telling you that you're not doing a good job, or, scolding you, that is something that you can let go because they're teaching you. However, it's not okay to accept any kind of abuse, if they're not doing right by you, you're more than free to, just take a break from them. What not to tolerate? Even if as a learner, if you're providing your service for the research, if you're working on a research project, you deserve the credit. So no matter what anybody says to you, that you've not done a good job, that you've not done enough, if you've done something for somebody's research project, you deserve to get credit for that. You deserve to be acknowledged for that. It's not okay to let that go. So that is something that you want to do. Well, I just went Colonel Kirk on all of you about research, about not what to tolerate. So just something to lighten the mood. You know, what your friends think you do, what your family thinks you do, and what you're actually doing is just sitting on your laptops writing grant applications. So that's how it is. A very important part of your whole USMLE journey is your mental health. As I said before, twice actually, that the USMLE journey is actually very taxing. It can get really lonely really quickly. So the important thing to remember here is that you have to take care of your mental health, because as much as it's a test of your physical strength, how much you can sit, how long can you study, it's also a test of your mental health, that how resilient you are, because there will be setbacks in your steps journey, and without a strong mental health, you won't be able to do it. Some of the things that you will be facing in your USMLE journey are peer pressure, imposter syndrome, feeling of being behind, and uncertainty about match. So the answer for all of these, I would say, is just remember that everybody's journey is different. And everybody has their own timeline, everybody has their own challenges, and everybody has their own destination. Even though everybody has started to do USMLE at the same time, you might not get matched at the same time, and that's okay. So the only way to deal with peer pressure and feeling of being behind is to remind yourself consistently that you have your own journey, just like everybody else has their own journey. So imposter syndrome, you'll feel that a lot of the time, I mean, you'll be doing steps. There will be people who would be scoring more than you. There will be people who would be doing more researches than you. There will be people who would be doing better observerships or better electives than you. But the important thing to remember here is that you are also better than a lot of people. I mean, when you're in a certain situation, there are two directions that you can see. That you can see towards the people who are better than you, take motivation, or you can see them and, you can start pitting yourself that you're not good enough. But just always remember that whatever you're doing, you're still doing so many things more than other people, and you are capable of doing all of those things. One rotation, one exam, one score, or one setback doesn't define who you are. So it's very important to remind yourself this over and over again, or you're going to go into depression doing steps. Uncertainty about match. I wouldn't lie. I was very uncertain about match as well when I started. It's very, very important to have the right kind of people surrounding you. Especially if you're somebody who has just started thinking about doing USMLE, it's very important for you to judge who you're talking to. Because I still remember that the first person that you talk to about your match or about USMLE is the person who shapes your view about that thing. If they're the kind of person who would tell you that USMLE is very hard, it's very uncertain, it's very difficult, it's a lot of money, then there's a very good chance that you'll get demotivated. But if at the same time, if you're meeting with somebody who's telling you that it's hard, but everybody does it, and you can also do it. So that is the kind of person that you want to keep around when you're doing your USMLE, because the process itself is so difficult and so tiring, and it requires so much dedication that it's very easy to get tired and to get demotivated. So it's very important that you keep people around you who are, who are loyal and sincere to you and who tell you the right thing. So it's very important. And on the other hand, I would say uncertainty about match. Well, once you get out of medical school, everything is uncertain. If you're not doing USMLE, you're thinking about FCPS or you're thinking about PLAB, everything is uncertain. There is nothing guaranteed. So you might as well just want to take a chance on it. Virtual job options. This is something that I get asked very frequently. So I am somebody who has done multiple IMG friendly jobs virtually uh, to earn for paying for my STEPS exams. The kind of jobs that you would often get are the virtual medical scribes or the virtual medical assistants, or you would be somebody who would be doing medical billing and prior authorizations. Uh, the way to, and then of course the USMLE tutoring as well. Where to look? You can always look at LinkedIn and your Upwork and all of these, but the important thing to consider here is that the US healthcare system, especially the private practices in the US, they always need affordable skilled labor. They always need people who would scribe for them, who would work as medical assistants for them, who would do the medical billing for them, and who would do the prior authorizations for them. If you're somebody who doesn't know prior authorization, I just want to tell you that since the US healthcare system works on, you know, uh, insurance, there are certain insurance, if not all, that require you to get a prior authorizations from those insurance companies that, okay, you're good to go to treat this patient, we'll pay you. And hospitals and even private practices require people to do those prior authorizations where you call that insurance company, verify the credentials of your patient, and ask them for authorization to treat that patient so that they'll pay for that patient. And this is something that the US healthcare system and the private practices in US require individuals for. And there is a need for skilled people to do these jobs. And mostly they tend to hire, or the private practices, they're often inclined to hiring people from the Philippines. The reason is that they do all of this work, they're very skilled in this work, and they're the cheap labor. Because if you're going to get somebody from the US medical students or the US college students or high school students to do this job, you're going to pay a lot of money to them. So what the private practices and the owners of private practices want to do is that they want to get people from the Philippines, they want to get people from Pakistan and India and all of these areas to help them do all of this work. So that is one way to, these are the kind of jobs that you can get. The question comes that how do you get these jobs? I mean, as I said, that you can always look at Upwork or LinkedIn and all of these. Those are definitely the good platforms. But one thing that worked very well for me is that you build personal connections, and that's how you land these jobs. What I mean by that is, I worked as a medical assistant for American telephysicians for about 3 years. I worked as virtual scribe for a pain clinic in the United States for about 6 months. Um, the way I landed these jobs, my American telephysician job was that I met somebody at a conference on my university who at that time I did not know who he was. I just met that person. He was a doctor in the US. I wanted to do USMLE. I got to talking to him. I got his email, and I went home and I Googled who this person was, just to find out what kind of doctor he is and if I should make a connection with him, if he can help me in getting residency. And what I found out was that he was the CEO of American Telephysicians. And when I found that out, I searched their online website and I realized, and I saw that they were hiring medical assistants. That's when I emailed him and I told him that I had met you on a conference in my college and I'm looking for a job and I have these expertise. And that person offered me a job. And I did that job for 3 years. It paid very well. It was a part-time job and it really helped me out. So that is one way I would say that you build your connections and that's how you land these jobs. The other way to do it is once you go to the US for your observerships or your electives, that's when you do this. We'll be talking more about the US clinical experience and the trip to US more in detail tomorrow. But just to give you a little bit of hint about it, um, when you go to US, you meet with many doctors, and especially if you're somebody who goes to the mosques and meet with people, you're going to find a lot of people who own private practices in the US. And those are the people that you want to talk to, that, oh, do you need a medical scribe? Oh, do you need a medical assistant? I can do this for you, I can do that for you. And they do offer you jobs. This is how you get your jobs. So communicate with people, talk to people, and that's how you're going to land these jobs, more than you would on any hiring platform. Your personal connections would be something that would really, really help you land these jobs. So this is how I would say that you find these jobs, and they pay very well, at least enough for you to be able to sustain your USMLE journey. And at the same time, they help you build so many connections with people, and those people and those long lasting connections are what helps you in your match. So that's all we had for today. And we'll be continuing this topic, and we'll be discussing the US clinical experience, finances, visa, the ERAS application, interviews, and how to build connection and use your connections tomorrow. So if you guys have any questions for me. Okay, so I keep getting questions. Okay, let's start. Somebody's asked me that if possible, could you please advise IMGs with your graduation more than 5 years on how to increase their chances of matching? So, while year of graduation is definitely a very important factor in getting matched, it doesn't mean that if you're an old graduate, 5 years or 10 years old graduate, you wouldn't match. What you can do about it is that um, the most important thing for an old graduate is, I would say, get a research position in the US. Why it's important? Because once you make that commitment of a year or 2 years, you spend 2 years in that place building connections. And at the end of the day, you need one job, one interview to get matched. So that is something that you can do, because of course a lot of people are getting good grades. A lot of people would have a much fresher year of graduation than you do. So I think that getting a research position and spending that 1 or 2 years in the US building your connections is something that would really, really help you in getting an interview and hopefully getting a match as well. So So the next question that we have, Boards and Beyond's videos are paid or free? Well, we have both of them. I mean, we have paid and we have free as well. So if you're somebody who can just clear your conscience and get free videos, use free videos and not pay for it, you can always do that on Telegram as well. But the ethical way to do it is that you buy your Boards and Beyond videos. Anki decks, I mean, you can use whatever decks you want. I mean, if you want to make your own decks, that's okay too. So, I mean, I don't have recommendation for any particular Enki decks, so I can't suggest which one to use. What is considered as a safe score for step two? Um, Safe score for step two, I would say, um, considering that what people are getting these days is a 260 or even 270s. But I think that if you have a 250 and above, you're on the safer side of things. So I think that 250 should be something that should be your minimum, and the more the better. As a visa requiring IMG, what difficulties did you face? Well, as a visa requiring IMG, the biggest difficulty that I had to face was that requiring visa. So, you get a lot of programs which are very good, but they're not sponsoring visas. There are a lot of programs which would not prefer you because they don't want to sponsor you visas. So that is one thing that is a very big problem for us. So, other than that, I would say it doesn't really make much of a difference, because if you're capable enough, your CV is good, your application's good, visa is not the biggest problem. I mean, it definitely is a problem, but I would say that it's not something that would prevent you from getting matched if you have everything else. So, okay. What do you mean by mentorship? Mentorship for what? Okay, good question. I'm sorry that I did not elaborate that. So mentorship, it's very important to have somebody, some of your seniors, to tell you how to navigate your match process. I mean, everybody knows that you want to take your exams, you want to do US clinical experience, you want to do volunteer work, you want to do research, but there are so many unsaid things in the process that you would not find on YouTube, that you would not find unless you talk to somebody who's been through that process. And for that purpose, you need somebody who is there to guide you through the process, especially very, very important during your match application, because match is actually a very tricky thing. It's not like that you just go and you submit an application. It's very tricky on how to apply, which programs to signal, how to reach out to people. So that is somebody that your mentor is somebody who's going to tell you all of those things. I'm sitting here and I'm telling you, and tomorrow we'll talk more about it, about how to build connections, but that is just one way. You will have so many questions along the way when you go and proceed with your USMLE, and you will need somebody to answer those questions for you. So your mentor is that person who would answer those questions for you. And who should be your mentor? Um, I believe that the best kind of mentors would be senior fellows in the US, or people who are just becoming attendings. The reason is that they have spent enough time in the US healthcare system to have observed the trends or the patterns of the process, but at the same time, they are motivated enough to tell you what to do. If you can get a very fresh resident like me, I'm going to be an intern this June. If you make me your mentor, I'll give you all the information that I know. But I'm pretty sure that there are so many things that I do not know. And I would not be the best person for that, because if I hadn't matched this year, I would be just like you. Just because I got matched, it doesn't mean that I am capable of becoming your mentor. So it's very important that you choose somebody who knows what they're doing and who actually have years of experience doing it, so that they can, guide you the best. Could you please further elaborate on how to find mentors and what is their role in this journey? So I just told you what their role is in the journey. I mean, they're your go-to person for all of your questions. You'll have so many confusions, and they're the people who are going to tell you how to navigate things. How do you find mentors? The best way to do it is to reach out to the people from your university, because you have that special bond with them, because of being in the same university. So those are the people who are the best kind of people for your mentorship. And the other advantage of this is that, which most of the people don't share, is that even in the US, there are a lot of the programs which repetitively take residents from similar universities. Like, I belong from Rawalpindi Medical Colleges, and there are particular programs in the US where you would find a lot of Rawalians. But there will be a lot of programs where you will find a lot of Nishtarians. There will be a lot of programs where you'll find students from King Edward. So when your mentors are from the same university as you, it increases your chances of getting matched in their own program. Because number one, they're your mentor, they can vouch for you. And number two, that program is already friendly and lenient towards your university. So that is somebody you can choose. But if you do not have people from, your university, you can always reach out to people from other universities, or whoever you think is very active on LinkedIn or Twitter or is offering to mentor students, everybody is good enough. I mean, at the end of the day, the important thing is that you have somebody who knows what they're doing. What about recent graduate planning for 2027 match? What about it? Could you please specify your questions, what you're asking? I mean, what about recent graduates? How many researches are enough to apply? So for the normal, I would say internal medicine or family medicine or psychiatry or neurology or peds, you do not have a very defined cutoff of how many researches you should have. However, if you're somebody who's applying to super competitive specialties like neurosurgery or plastic surgery or ENT or orthopedics, then of course you would need more than 30 or 40 researches. But if you're somebody, I can just speak for internal medicine. If you're in internal medicine, as I said, what is the role of doing research? Number one, most of the hospitals in US require you to have research experience because they give importance to research. And the other thing is that they want to make sure that you're not just about books, you can do more than one thing. So in order to do that, it's more about the quality of your papers than the quantity of your papers. You can do 50 research papers, but they're not published in good, reputable, peer-reviewed journals. It doesn't carry any worth. But if you, on the other hand, if you have 5 or 6 researches which are published in, PubMed Index journal and good journals, that should be more than enough. Are 9 to 10 abstract enough, including published abstract international and get published too, enough for internal medicine? I would say yes, definitely yes. Research faculty don't even reply. I'm so sorry, mine doesn't too. Do they give authorship? I mean, what are you talking about? Who gives authorship? I'm sorry. What about preclinical research? Preclinical research, what is that? So as I said before, that it's the hierarchy of your research that is going to take you from step 0 to, the top. So wherever you start from is definitely fine. The most important kind of researches that are done in the US are, bench, translational research, clinical researches. But nobody expects you to be a medical student and to be able to do a clinical research, nobody expects you to have just graduated or even becoming an intern in the United States and being able to do a very big research project. So wherever you're starting from is good enough. The important thing is that you just move on from wherever you're starting and going in the right direction. That is the most important thing. Can you please guide a little about ophthalmology residency in UNS? Anything you would like to suggest aspirants? About ophthalmology, I believe that it's very, very competitive. And one thing which I have heard from a lot of people about ophthalmology is that most of the ophthalmology programs in the United States, they do not sponsor visas. So what people do is that they try to find out research positions for ophthalmology, which would offer you H-1 visa. And then you spend like 4 or 5 years on that research, you get your green card, and then you apply as a green card holder for ophthalmology. I know somebody who did it like this. So that is what I can tell you. But other than that, I do not have a lot of information about what to do about ophthalmology. But it's super competitive. That's what I know for sure. Is abstract alone a red flag if I don't have its full script? No, it's not. It's always a very good idea to convert your abstract into a full text script. But even if you're not able to do that, it's always a good idea to do something. I mean, if you're getting the option to do an abstract, don't leave it just because you can't have its full text. You can always write an abstract and present it in a good conference. So, I mean, you have to show your work to the world. It doesn't matter if it's an abstract or, a full script. Is Curious a Predator journal? Curious is not my favorite journal. I mean, I wouldn't call it a Predator journal, but there are better journals that you can reach and can publish for free. So, I mean, if you can do them there I would like to avoid, publishing and curious. How did you land a virtual research position? Again, I would say the same thing that I did an observership, and the supervisor I was working with, he had just gotten a grant for a research, and it was not a very big grant actually. It was just an epidemiological study, and the grant was, I believe, it was a $10,000 grant. So when I talked to my supervisor about it, he told me that in that $10,000, there is no way that he can sponsor a visa for me, or he can give me an allowance to stay in the US. So what I offered was that, let me just work as a virtual researcher for you. Let me do the paperwork for this. Let me write let me do the writing part. Let me do the data, your people do the data collection. Let me do the analysis part, the parts that I can actually do from here. So I would say that that's how I landed my research position. We'll be talking more about the US clinical experience tomorrow, and we'll go in a lot of great detail on what to do during your US clinical experience. It's not just about going to the hospital and getting a recommendation letter. Can medical students also do these medical assistant positions being in Pakistan? I was a medical student when I started doing the medical assistant job. I believe I was in my final year of medical school when I started doing it. So yes, if you're a medical student, then definitely you can do it. You just have to find the right people. Is abstract alone? Oh, sorry. What are the skills required to get these virtual jobs? As I said before, the important things are to understand the billing process and the prior authorization process in the US. And the billing and the prior authorization process is one thing which is very important. You can always learn it from YouTube, and that is something that would help you into, landing these positions. The other thing definitely is good communication skills. They don't want somebody who, I mean, I would say that landing a research position requiring and having good communication skills, it's a loop, I would say. If you have good communication skills, you would land a medical assistant job. If you land a medical assistant job, it would definitely hone your communication skills because you're talking to native English speakers. So definitely it helps with your communication skills a lot. So that is one thing that you can use. Can you share the email of the CEO? Just go to the website of American Telephysician. It's all there. Can we get the recordings? I think Dr. Nabil is going to tell you in the end how you can access the recording. How realistic are the chances of matching into surgeries? And also, I would like to ask the same for competitive fellowships like cardiology. Realistically speaking, when I thought I would do USMLE in final year, um, I thought about surgery, and the feedback that I got from people was that, oh, surgery is too competitive, you can't get it. But the thing is that if you're talking about general surgery, I would say that there's a very good chance to match into general surgery. However, of course, there are some super competitive specialties, like we talked about, like ENT, or the other subspecializations of surgery, like ophthalmology, or even gynecology or obstetrics. Those are a little difficult. But if you're talking about general surgery, I would say that it's and neurosurgery, of course. But if you're talking about general surgery, I would say that there's a very good chance of matching into general surgery. Since the internal medicine is becoming way too saturated, a lot of the people are going towards general surgery. I think that the reason previously getting into general surgery was harder was because very few people were applying, and that's why you would think that people are not matching into general surgery. However, I think that now when people are applying into general surgery more and more, and we have so many amazing candidates, and they're all doing amazing work, amazing grades, and all of the other things, I think that it's very, very good that you can match in match in general surgery. And for competitive fellowships, in my opinion, I think most of the Pakistanis are cardiologists in the US. So it's definitely competitive, but so are you. If you want to do cardiology, you are the kind of person who does cardiology. So once you get into the system, you can do whatever you want. What about Melman's PDF for step one? I would say that they're very good, but if as I said before, that you will come across multiple resources. if you have opened the PDFs of Malman for different organ systems, you'd see that they are very extensive. They are way, way, way too extensive. So if you want to go through them, you can go through them. But the problem is that a lot of the things in the Melman's PDF are a little different from what's written in the First Aid and New World. So it can confuse you at times. However, there is one PDF of one or two PDFs of Melman that are very, very good. And I think those are the high yield concept from Melman's. I'm going to confirm that, and I'll just remind me and we'll discuss it tomorrow. There is one PDF, one or two PDFs about Melman that are very good for step one. Resources for step two, UWorld, and the other supplementary resources we talked about, MBOS, Divine Intervention Podcast, and CMS forums. As I said before, that I'll be sharing the PDFs of all of these things in the coming weeks so that you have all this information, because I understand that I've said so many things that it's very easy to forget them. So I'm just going to make sure that you guys get it in writing too. Are 9 to 10 abstracts good for including published abstract? Yes, of course it is. Could you please tell how to get a good U.S. clinical elective or observership? We'll be talking about it tomorrow. Tomorrow we'll be talking about the U.S. clinical experience. So that's where I'll tell you in great detail about how can you land in good observership programs and what are actually good observership program. How to find a mentor, I think we've already discussed it. As someone looking to get into research, how can Nibras Research Academy be of help? I think that the CEO of your Nibras Research Academy is the right person to ask this question. But I think that these people are I think that they're doing an amazing work, and they're going to tell you a little bit more about how you can work with them. What are the skills required for these virtual jobs? We just discussed that. How you did 30 researches in 1 year? As I said before, I started learning research while I was in the third year of my medical school. So I followed the hierarchy. I learned from YouTube. I learned from people in my university, and I started working with them without getting authorships. And you do one thing at a time. Like the first thing that you want to do is that you just start learning how to write a paper, how to write an abstract, or how to write the synopsis, and how to write the full text paper. And once you learn that, you work with different people and you just do the writing part of that paper. Once you're skillful in the writing part of the paper, you move on to the next step. You start learning how to do screening, how to do analysis, how to make graphs, how to make the pictures for your research and everything. So you do things step by step. So once you're skillful in research, meta-analysis does not take a lot of time. If you're fluent in research, if you know how to do things, I can say that you can do one paper in about 2 weeks. And if you have the right kind of support, right kind of people who are there to help you through it, you can definitely do one paper in 2 weeks, 3 weeks. That's how you do it. So that's how I did it. That I published 30 papers in 1 year, but the struggle of those 30 papers, the learning phase of those 30 papers is the last 4 years. So once you get fluent, you can definitely do 30 papers in 1 year. Having clinical electives at clinics is okay, or we need to have a hospital-based LOR only. We'll be talking about it tomorrow in the US clinical experience. Somebody's shocked that I did 30 papers in 1 year. I just told you how I did it. Does it really matter if you're doing electives in clinical-based setting, or is it very important to have hospital-based letters? We'll discuss that tomorrow. How to explain gap of 3 years from graduation to match application? Well, I just got a text from somebody saying that, how do you explain a gap of 3 years from graduation to match application? So the important thing is to be honest about it. I'm sure the 3 years, you were not in a coma for those 3 years, right? You were definitely doing something. You were working, or even if you were not working, you were going through something in your life. We don't know what that is. The most important thing is to be truthful about it. I'm pretty sure that you were not just sitting at home watching Netflix for 3 years. There must be an explanation of why do you have a 3 years gap from your graduation. So being honest and, uh, just putting that honesty under the covers of your hard work, and anything that you've done in those 3 years is the right way to, deal with it. If you want to text me privately on LinkedIn, we can discuss this more. So just feel free to text me there. Very important to have hospital-based letters. Do JCI recognize electives from Pakistan help in USMLE journey CV applications? Uh, Okay, so we'll be discussing this again tomorrow. I'm sorry I can't answer it right now because our time is extending. So we'll be discussing it tomorrow because we're dealing with we're going to be dealing with the U.S. clinical experience tomorrow. So how do you get electives in Mayo Clinic, Texas Hospital, Johns Hopkins? We'll be discussing that tomorrow. It's realistic to hope for ophthalmology mass in the US. It's realistic to hope to get MASH anywhere you want. It's just a matter of how much time and effort it's going to take, but of course you can match anywhere. Given the importance of the year of graduation, should you aim to do USMLE step one during medical school and not after? And if which year of medical school should you? So I would say that the ideal timeline for your USMLE is that you take your step one in after at the end of your third year or start of your fourth year. The reason being that your step one content is basically what you've studied in the first, second, and third year of your medical school. So it actually makes things easier for you. But if you haven't done in your third year or fourth year, it's not the end of the world. I didn't do it. I did it after house job. So in an ideal world, yes, you should do it in third year or fourth year. But if you cannot do it, then for whatever reason, it's completely fine. You can do it whenever you want. Step two resources, we've already discussed it. Does elective in LORs from international recognized hospitals? We'll be discussing that tomorrow. This way we have to put an entire year after graduating. We'll take step one during medical school, save time somehow. Also, how much is the total expense? As far as the expense is concerned, that is also something that we're going to be discussing tomorrow. I'm going to be discussing the total expenses, the total cost of the whole USMLE process, and how you can deal with it if you're not somebody who's sitting on a pile of money. How did you find observerships? We're going to be doing tomorrow. Having residency interviews, would you say that the amount spent on observerships, super expensive places, worth it? I do understand that Johns Hopkins has a super expensive elective program, but at the same time, I did free observerships in Johns Hopkins. How I did it, we're going to be talking about it tomorrow. Untold things, please elaborate. Just what are those untold things? There are a lot of untold things. Nobody tells you about the importance of connections. Nobody tells you how important it is to signal the right programs. Nobody tells you how to reach out to programs, what you should do before you apply for a match or after you apply for a match. And these are the things that we'll be discussing in tomorrow's session. Are 9 to 10 papers enough? Budget for electives in the US, we'll be discussing it tomorrow. If I failed in 1 year at medical school and will graduate with low grade, will affect my match chances. In your match application, you do submit an MSP, which is the medical school performance evaluation, which will mention that you have, and your transcripts as well, which will mention that you have, a supple or a fail in one of the exams. While it's not ideal, it's not the end of the world. You can always compensate. You should definitely not give up on doing USMLE just because you failed in your university exam. So that's how would you rate your basic or fundamental knowledge during MBBS Plus? Were you a distinction holder or such as 85%, like what made you able to qualify all 3 steps exam in a year? Even if my foundational or basic knowledge of medicine was good, I took my step one 3 years after studying, 4 years after studying those basic concepts. So I definitely forgot a lot of things. But distinction holder, or well, I have a distinction in behavioral sciences if that's what you're referring to. But other than that, no, I wasn't. What made you able to qualify all 3 steps exam in 1 year? I would say that the only thing that why I did USMLE in 1 year, I have so many reasons for that. The number one is that I was feeling very far behind that, oh my God, I'm getting old. My year of graduation is getting old. The other thing was that I'm generally an anxious person, and USMLE is a very stressful process. And I knew that there was no way I could spend 3 or 4 years in this stress. I would have gone crazy. So that stress or that anxiety was one of the reasons that I decided that, okay, I'll take a lot of stress in 1 year, but I'm not taking this stress into the next year with me. So that was one thing. And qualifying all 3 exams in 1 year, I would say that the key to doing so many things in 1 year is to stay super organized. Once you relax, as I shared in my when I started this, that I completed my house job in September and I started preparing for my step one in November. The gap of that 1 month, the October month, was when I relaxed my mind, my body, everything. And that's when I made a plan of how I'm going to do these things in 1 year. And when you make a plan with your fresh brain, you always make the right plan. The important thing to consider is that do not change your plans just based on your anxiety. If you're feeling that, oh my God, this is not possible, it's not happening, just take a step back, reflect on what you're doing, and then decide what you want to do. But don't change your plans just because of your anxiety, because a lot of the times you're just going to be thinking that things are not going well, when in reality, they're actually going very well. So I would say that the key to doing all of these steps was that I was super organized and I made a plan to do all of this with a very, very relaxed brain. Observership is allowed to on USA, like is job allowed? No, it's not. It's not. That's because I told you that it's the virtual jobs, which means you're doing them from your home. If I failed in 1 year medical school, low grade, your accent is so good. Oh, thank you. Well, if you want to talk about accent, we're going to be discussing the communication part of the whole process tomorrow. What I would say is, well, I'm going to say this tomorrow, but I'll just say it out for you. Your interview preparation for your match does not begin when you get an interview. The preparation for your interviews, it begins when you enter medical school. You have so many qualified people around you, your peers, your seniors, your teachers, that you should be learning from them. And you should say that this is manifestation. So manifest the life that you want. Manifest being the kind of person that you want to be in the future, right? So I'm sorry, just give me 1 second. So that's what I would say, that it comes up with practice. I used to talk like this with my friends, with my colleagues, and in the start, it was very difficult. Because when you're talking like that, a lot of the time, you're not talking in the best way possible, and you do get laughed on, but that's okay. At the end of the day, you're gonna be the person who's laughing on the people who are not going anywhere. So, I mean, just start right now and you'll get there. How to explain a gap of 3 years after match application? Is 5 years score of can affect on my USMLE match? The score, yes, of course, the medical school performance evaluation is something which your university gives you for before your match application. So in that, it's written that you have good scores and you have distinctions and all of these things. So yes, it's a good impression when you have distinctions or you have really great scores. But just because you don't have distinctions doesn't mean that you're not going to get matched. So that's how it is. Financial challenges during your USMLE journey. We're going to be talking about it in great detail tomorrow. Answer these questions in written. Of course, I'm going to be answering those. The specialty depends upon what factor? What are the causes of late matching? The specialty depends on what factors? I don't understand your question. I'm sorry. What do you mean by specialty depends on what factors? Could you please just specify that and I'll answer it for you. What are the causes of late matching? If somebody doesn't match in one cycle, there are so many things that can lead up to that. We'll be talking more about it in detail tomorrow because we're going to be covering the match and the ERAS and the communication and the US clinical experience part tomorrow. But I would say that there are so many controllable and uncontrollable factors. You can be the best possible candidate, but it's just not your time. Or there could be certain things that could be lacking in your application. And even if you do get an interviews, you could be having problems with your communication, or you did not signal the programs correctly, or there are so many things that can that can be the cause of late matching. Translational medicine, gene therapy, stem cell course. Yes, I understand that. And definitely it is, as I said, as long as you're doing quality research, you're good to go. Pass 1 year of med school without any good grades to pursue step 1 that year. Yeah, I would say that's fine. I mean, I think that we've answered this question before as well, that if you have distinctions, that's great. But if you don't have distinctions, that's okay. Where did you learn data analysis? Can you suggest free courses for free? YouTube, best resource ever. Or just get a paid version of ChatGPT and ask it to teach you how to do data analysis. How you became medical assistant, I've already answered that. Thank you so much. You answered my question. You're very welcome. How do I, as a medical student, find a virtual part-time medical assistant billing job? I have no connections and just on LinkedIn. How much do they pay hourly? Can you please give us an estimate? Okay. Since we're going to be discussing how to build connections and the importance of those connections in great detail tomorrow, I'm just going to say a little bit here. I do not have any family in the US. I do not have any close friends in the US. When I started, I did not know any doctors in the US. And when I applied for Match, I had about 20 people who had recommended me to their programs. How did that happen? I built those connections over years. I decided that I wanted to do USMLE while I was in final year, but I spent 2 years after which I started preparing for my step 1. So when I decided that I want to do USMLE, I started reaching out to people and I started asking them that I want to do USMLE. What should I do? What should I not do? And when you text like 50 people on LinkedIn or on Messenger or even on Facebook or email them, out of those 50s, you will get at least 10 people who are willing to help you out. So the important thing to do is that the long-lasting relationships are the things that are going to help you. If you reach out to somebody today and you ask them for a favor tomorrow, they're not going to do it for you. But if you meet somebody today, you're keeping them posted about your progress, that, oh, I just took my step 1, oh, I just graduated medical college, oh, I just took my step 2, and Eid Mubarak and happy birthday and all of those things. That's how you build your connections. And those are the connections that are going to really, really help you out. So for starting point, yes, LinkedIn, Messenger, Twitter, see who are the people who are active on all of these platforms and just, ask them. How much do they pay hourly? So in the US, the medical assistant or a medical scribe, they get paid from somewhere around $12 to $15 per hour. But when they're hiring Filipinos and people from Pakistan and India and Nepal and all of those areas, they pay you close to, I would say $5 to $7 per hour. But even in that case, if you are giving more number of hours and you're working with a person who is a good leader, they would actually pay you very good amount. And when you're working as a scribe, more than hourly, usually there are the number of forms or the number of charts that you fill, and that can range somewhere from $15 to $20 per chart as well. So it's a good amount of money. Okay, so chances of residency and fellowship in anesthesia, good enough. You can definitely match in anesthesia. I have a friend who recently matched in anesthesia. If we have a longer year of graduation to increase our chances of psychiatry match, I just shared that already. Does getting a residency position back in the home country increases the chances? Definitely, it does, of course. If you're an old graduate who has done their residency in your home country, that's a very good excuse for filling that gap year. And that definitely counts, given that your residency is in the same specialty that you're applying. Like you're referring to psychiatry, I would say that if you're doing your residency in psychiatry here in Pakistan, then definitely counts. However, if you're doing it in ENT and then you want to apply for psychiatry, that might be a little bit of a problem. I mean, you're going to have to explain to them why you shifted from ENT to psychiatry. Anything else particularly help for psychiatry match? Your CV should be psychiatry oriented. Definitely, I have a friend who's interested in psychiatry. So, what you do is that you do researches in psychiatry, you do your observerships in psychiatry, and just generally all together show that you're interested in psychiatry. Many congratulations for your match. Thank you so much. You're a sweetheart. How do programs look into the applicants who are doing tons of systematic reviews, meta-analysis, they're getting crazy numbers, 7 out of 50, so is it good to have? I had 30 papers in 1 year, and I would call that crazy as well. And yes, you're right. They do look at that. In one of my interviews, the person actually asked me, how did you do that? As long as you're doing it in the right way, you're not cheating, you're not just getting your name entered into papers by paying money, you'll always have an answer. The only problem that comes with your match interview is when they ask you a question that you do not have an answer for. So when you're doing the right thing, you definitely have an answer for everything. So as long as you have an answer, you're good to go. Remote research assistant at Mayo Clinic, a good thing for a medical student. Would it help match? Of course, definitely, yes. Could you tell again what job you landed in American Telephysicians? Is there potential to get a research opportunity that way? With American Telephysician, there is no potential to get into research projects because it's a telecommunication company. They're not into academics or research. So no. And on the other hand, you say that what job did you land? I worked as a medical assistant. Can you give us mentorship on research? You are actually at the right place. This webinar is arranged by the Nibras Research Academy, and they can provide you great mentorship for research. As for me personally, I'm sorry because I'm starting my residency in June, so I do not have that kind of time right now. How to explain personal reason or any kind of social reason as a gap? We can talk more about it in, I would say in the personal chat because it seems like a personal question to me. But whatever happened, whatever the personal or social reason was, you definitely don't want to lie. Is it possible to pass step 1 with dedicated 2 months of prep? I passed it with 3 years. I think you can definitely pass it. As long as you're getting a consistent score in your NBMEs, you can. I'm glad you're not a multi-distinction holder because most of people who a lot of distinction holder take it easy. They would bring a lot of stress too. No, I don't have. I just have one behavioral science distinction. Share your time management strategy. How to stay the same energy single day as per you. How to stay super organized. Okay. As I said before, that I'm somebody who's very, very anxious. So that comes with its super shit. That comes with its good things. Staying super organized is something that helps with anxiety. So that is one of the reasons. And keeping the same energy every day for 3 months, it's not humanly possible. The important thing is that you take your breaks. Your physical health, even though you're young, you might feel that your physical health is not of concern, but when you're doing something as stressful and as strenuous as the USMLEs, you want to take care of your physical and mental health. So I would say that in your study schedules, always keep your time for for taking out walks, for exercising, and make sure that you're eating healthy, and keeping your good people around you. You don't want toxic people around you. You don't want people around you who will tell you that you can't do step 1 in 3 months. If there is somebody who's telling you you can't do step 1 in 3 months, you might just want to block that person. I wouldn't talk to that person again. You already know you're going through a lot of stress. You don't need that kind of energy in your life. Thank you for your time. Of course, no problem. See you tomorrow, definitely. How to take stress as a source driving you forward in your journey rather than vice versa as it's come to common public. Behavioral sciences kind of question about being a distinction holder and know better to read someone. Well, just because I had a distinction in behavioral sciences doesn't make me an expert in the field. But I can answer this for you. That how can you take the stress as the driving force? So as I said before, that you can always look at things in one of the two ways. You can look at something and you can feel sorry for yourself and you can feel bad for yourself. And, you can just say that, oh, I cannot do it. On the other hand, you can just look at it as a motivation for, as a driving force to push you to do things. So for me, that was the driving force. However, it came with its shared time of, fair share of anxiety and stress. I was so stressed, and there were a lot of times when I used to feel that my goals or my plans are overambitious and unreachable. But the important thing is keeping the right kind of people around you. Because at the end of the day, you'll always have those days when you'll feel that you're too stressed, you cannot do things, you'll question your decisions, you'll question your choices. And that's the time when these people come in who are good for your mental health and who will give you sincere, legitimate opinions. So it's very important to keep those people around, and those are the people who are going to keep pushing you when you cannot push yourself. I'm currently an FSC pre-medical student aspired to USMLE from grade safe. First proper webinar that I decided to attend to really understand what getting myself into, and it's been really helpful. Oh, you're very welcome, and best of luck. Thank you, thank you. Thank you, you guys are super sweet. How many hours per week did you spend on your work as a medical assistant? Hours per week. I used to work 5 days a week for 4 hours per day. So 20 hours, I'd say, per week. Because I used to work according to the American time, so I would work in the evening from 7 to 10, 7 to 11. Systematic reviews, meta-analysis, observational study, which one is better considered for us medical students? Which one you should focus more? Observational studies are definitely easier to do. So if you're a person who is just starting your research career, I would say that start with the observational studies because they're easier to do, they're simpler. So that's where you want to start, and then you grow into doing the systematic reviews and narrative reviews and the umbrella reviews and everything. Unsure about specialty they want to apply for, then how can they prepare their CV according to which would generally fit in them? I think that that's a very good question, that how do you define your specialty? I think that the first thing that you want to do is that make the basic choice. Do you like medicine or do you like surgery? When you're in your final year of medical school, you get to do so many elective rotations. You do medicine, surgery, peds, and gynae. That is one time which will actually give you a lot of clarity about what you actually want to do. And the way to approach it is that you decide, do you like medicine or do you like surgery? If you like medicine, do you want to see, do you like internal medicine? Do you like pediatrics? Do you like family medicine? Do you like psychiatry? So that's when you start seeing into things that, do you want to do a fellowship? Do you want to like go into cardiology or gastroenterology? If yes, you want to do internal medicine. Are you somebody who wants to have a very good work-life balance, chill, relax after 3 years? Family medicine might be the good choice for you. Do you like kids? You can do definitely peds. Do you want to make a lot of money and have a relaxed schedule? Definitely go for psychiatry. So every job has its particular, benefits and a particular kind of life. So I think that the best approach to do this is to see what kind of life do you want? What's the most important thing to you? Do you want to be somebody who wants to go into super competitive academics? You can definitely do that. If you're somebody who wants a good work-life balance, you can go to those specialties. If you're somebody who want to make a lot of money, you can go to those specialties. So it really depends on what your priority is. What I have to do to you as mentor, will you be my mentor? That's really sweet of you, and I am here to answer all of your questions. But as for one-on-one mentorship, I'm really sorry I can't do that. The reason is that I'm going to be starting my residency in June, and even if I did decide to mentor you for this 1 or 2 months, it's not going to be enough, because after June I won't be able to do it, and then you'll have to drastically shift from me to somebody else. So it's better that you get somebody who is going to be there throughout your match season. Uh, Thank you so much. You guys are so... Oh, you guys are so cute. And I'm sorry, somebody is asking question. Okay. Yes, please, Afia, go ahead.
Dr. Sheena. Yeah. Hello, Dr. Sheena. I
Hi.
was for the session, I was like so amazed by the way you were speaking and your energy level. I mean, you have started from so early and you addressed all the questions. Thank you so much for that. I actually have a question. Like, I'm from Bangladesh, and in
Mhm.
our country, after completing 5 years of medical school, after completing MBBS, we enroll into an internship period for 1 year. But we are given our certificates, and on the certificates, that year of graduation is mentioned on the day we have completed our MBBS. So, is the year of graduation that the US is considering, will it be like the day we are completing our internship or the day our MBBS certificates we are receiving that?
Okay. First of all, thank you very much for your sweet words. I'm honored to do this for you guys. And the system in Pakistan is the same as well. That once we complete our MBBS and we take our exams, we're also required to do a 1 year house job. Although that's not a requirement for getting our degree, but that is a requirement nonetheless. So yes, the date of graduation is the date that your final year exams and you get your diploma, not the date of your when your house job ends. For example, I graduated in 2022, but I completed my house job in 2023. So my year of graduation is 2022 and not 2023. So I think that was your question.
Thank you so much. I actually have another. I have so many questions. I just wrote them down while you were taking the session. So another question is that you told about the hierarchy of research, gradually building up the hierarchy. So, like, if I want to conduct a cross-sectional study, and for that cross-sectional study, like, I need someone's guidance, a professor who is expert, who's actually a scientist and a physician at the same time of the USA. Like, can this be a way of emailing them and getting them involved with me in research? Can this be a good way?
Okay. Um, the main thing about research or reaching out to people is your level of expertise in the research. If you're somebody who is frequent and skillful in research, you do not have to follow that hierarchy. If you're somebody who is already on on a very skilled level of research, you can definitely reach out to people from the US, the attendings, and you can do research with them. However, if you're somebody who's just learning research and then you're reaching out to people from the US, uh, it's very likely that it wouldn't work out. The reason is that the people in US are so busy that they do not have the time to teach you research. So if you're a learner in research and you do get to manage to start a research project with some attending from the US doctors, what would happen? You will make mistakes in your paper. Everybody does when they're learning, right? Um, but they would not be there to teach you how to correct those mistakes, other than a few very good people who might even do that. But most of the people would not actually teach you how to correct those mistakes. So instead, they'll just leaving your all of your hard work, just down the toilet. So if you're somebody who is skillful in research, definitely go ahead and reach out to US attendings and whoever you want. But if you're a learner, I would say that first you become skillful and then you reach out to these people.
Thank you so much. I actually have another question. Like, sometimes we get invitations for reviews in specific journals. So, if we review articles in journals, how is it valued in our application?
I'm sorry, I missed that. Can you repeat that again?
Sometimes we get invitation from journals for reviewing articles, for reviewing manuscripts. So, if we review articles or manuscripts for journal, how much is it valued in our residency application?
Definitely. It's definitely a good thing as long as you're not being exploited, because what I mean by that is that sometimes you'll get invitations to be a reviewer for a predatory journal. um they would make you spend your time, your energy, would promise you a lot of benefits, but you won't actually get any benefits. So that is one downside, that if you're getting this offer from a legitimate journal, definitely go for it, because that is something that you will learn a lot from it. And the other thing is that you can this is definitely a talking point for your interviews as well, and you learn a lot from them. So yes, if you get some of this offer from a very legitimate journal, definitely go ahead.
Thank you so much. I actually have one last question, and it might be personal to you. If you're comfortable, you can share it with us here. So, while preparing for step one, step two, and step three, you said that you have like 30 publications and more during this 1 year frame. So, during your preparations, did you continue your research journey, and were you involved in any of the jobs that you mentioned while you were preparing?
As for when I was preparing for my step one, I was working as medical assistant, but I was not working on any research projects. The other thing was that I did a lot of research while I was in the US. The 4 months that I spent in the US from February to May, those 4 months were the time when I was studying undedicatedly for step two. So those 4 months were the most important time when I did most of my research projects. So yes, I was working on papers at that time, but during the dedicated part of my step two, which was the 3 months period, I was not doing anything else.
Thank you so much, Dr. Sheena. That is all from me for today. And hopefully I'll be asking questions tomorrow as well. Thank you so much and for your patience or for explaining everything so beautifully and addressing all the questions.
No, you're very welcome. So if there aren't any questions anymore, I would give it over to Dr. Maria. Yes, Fatima. Wait, let me just unmute. Yes, Fatima, please go ahead.
Hello, Assalamualaikum, Dr. Sheena. Thank you so much for giving your time. This is such a wonderful session. Thank you so much. The question which I want to ask you is this. I graduated in November 2023. And on June 25th, I gave my step one exam. And in those 7 months, I was preparing for my step one. And I passed it in June 25. I gave my exam on 25th of June. And after that, I started my house job after 7 months of gap. And I did 4 months of house job. And then after my house, I was not able to manage my studying for step two and my house job simultaneously. So I resigned from my house job. And till date, I'm preparing for my step two exam. The thing which I want to ask you is that the first thing is, okay, I think I'll be able to take my exam maybe by August or early September. And even if I do that, that score would be a very mediocre score. And if I aim for a very high score, for example, 260s, 70s, as people do these days, I think it will take me a lot of time. And at this point, I'm not sure how much time it will take me. So the first question is, what is your opinion on applying in this math cycle without any USC, though I have a valid visa? But till that date, I have not done any electives or observerships in the US. I have 2 PubMed indexed research papers. Both of them are review articles. And currently, because I do not have any guidance or mentorship as such, but I am working on a couple of research projects. The question which I asked you, how to explain the gap in CV, I decided it myself, okay, so I can say that, okay, I was working on these researches when I was preparing for my exams. So what would you guide me? What would be your suggestion? The circumstances which I am in, and I have told you my entire scenario. So what is your take on it? I'll be very grateful to hear from you. Thank you so much.
First of all, walaikum assalam. And to answer your first question, that you want to apply in this match, you don't feel that you have enough time to score a 260 or a 270 on your step two. I would say that one thing that you cannot change in your whole USMLE journey is your scores. So you can always get more US clinical experience if you don't match the first time. You can always do more researches. You can always do more volunteer work. But the two things that you will never be able to, get back are your year of graduation and your scores. So if I were you and I had less time and I had to choose between applying for a match this year or waiting to get a higher score, I would choose waiting to get a higher score. Because if you get a mediocre score, because it's very competitive these days, if you get a 230s or a 240s, you it's so competitive that if you don't match in this cycle just because you hurried, you won't be able to change your scores again. So I would suggest that the preparation of step 2 should be, the it should be oriented in the direction of your preparation rather than directed in according to the time that you have. You should not adjust your preparation in the time that you fixed for yourself, but you should adjust the time for the preparation that you want to do. So that's about it. As far as the that is concerned, the part about explaining the gap between CV. So as I said before, that you always have to be honest about it, that you were studying or you were doing research projects or you were taking the time off. And in your ERAS application, you don't actually have to give all of the details of what you were doing since you graduated. That is something that you have to do for your visa once you get your match. But by that time, you've already matched. So it's possible that they would ask you this question. Sometimes they can ask you this question in your interview for residency, that what were you doing in these 3 months? So what you do is that you take those things and it's called gray rocking. You just gray rock your answer. You tell them, oh, I was preparing for my step 1, I was doing research and I was doing this and that and that. You do 2 things and you just make them seem like they were the biggest things in life. So I mean, you have to be a little diplomatic in your answers when you don't have the right answer for something. But as long as you were preparing for your exams and doing some research, I think that should be able to cover it in case somebody asks. Yes, go ahead.
Hello, can you hear me, ma'am?
Yeah, I can hear you. Go ahead.
Actually, I'm from India, ma'am. I'm also preparing for USMLE.
Mhm.
I have a small doubt, ma'am. Actually, what means I'm 16 batch student. I did my I graduated from China. As I'm 16 batch students, I completed my 4.5 years plus 1 year, like 4.5 years in June 2021. And like in India, we have a entrance examination for foreign graduates, ma'am. I completed the exam in December 2021. Since those time was COVID, we were not allowed to do internship in China. So like from Jan 22 till July 23, I was in India, but I did observership in some in my state, some hospitals. So in July 23 only we were allowed to go to China. So I did my internship from July 23 to July 24, and my certificate of graduation I graduated in 2024, and I prepared for step 1 and done with step 1 in February, 2 months before. I'm preparing for step 2, ma'am. Gonna complete this year. So will that 1 year, 6 months, like almost 18 months, will that affect during my match process, ma'am? Like,
So just the way that you've explained all of it to me, as I said before, that in your ERAS application, they don't ask you for everything that you've done since you graduated or since you completed your house job. This is something that they can ask you in interviews. So when you're in the interview, what you do is, how you explain your gap is, there's definitely always something that you were doing during that time. It's,
yeah,
as
ma'am.
you said before, you were not sitting and watching Netflix, right? You were doing
Yeah.
something and you have certain explanations for those things, that there was COVID and you could not go, you could not do electives. So those are the things that you tell in your interview.
Okay.
The people who are taking your interview, they don't expect you to be perfect. They don't expect you to, I mean, it's not humanly possible for anybody to not have any gap in their application. I don't have any, I have so many unexplained gaps in my application as well. You're a human being. You need time for yourself as well. You can have so many commitments. You can have family commitments, social commitments. You could get sick. You could have so many other constraints. Nobody expects you to not take a break for a single day and do everything nonstop. Okay. So, whatever happened in that time duration is something that you tell your interviewers, but in a way which makes it seem like you weren't wasting your time.
I
Do you
understand,
understand what
ma'am.
I mean?
I understand. I understand
Yeah.
totally.
So that's how I would do it.
Thank you, ma'am. Thank you for your response. Thank you.
Of course. So I think we have no more questions. Okay, if we do not have any more questions, I'm just gonna unmute Dr. Maria, and she's gonna take over for me. Expenses, we're gonna be discussing these tomorrow. So Maria.
Okay. Thank you so much, Dr. Shamoon, on behalf of Research Academy and all our participants. And a heartfelt thank you for sharing your invaluable time, inspiring journey with us today. We are grateful for
Very
your
welcome.
generosity in answering questions so thoughtfully, and your insight will shape many success stories in this room, I will believe. Thank you for being there, and thank you so much. Take care, everyone. Take care, Dr. Shamoon. Allah Hafiz.
Thank you guys. Thank you very much for having me, and I hope to see most of you tomorrow. So take care. Good night, guys.
Thank you.